In 1850, Sacramento suffered a deadly cholera epidemic during the height of the gold rush. More than 5,000 people died, and thousands more fled the region, fearing for their lives. The working conditions were rough, but not one of the licensed physicians left their city. Instead, they stayed together and fought to protect the people and the city they loved. 17 doctors paid the ultimate price for their service, giving their own lives to stay and help. The doctors who survived realized that for the health of their state, they'd be stronger working together. And on March 12, 1856, the Medical Society of the State of California held its first meeting in Pioneer Hall on J Street, Sacramento.
When you think about 160 years, it seems astronomical.
Public health needed them to get together. There were a lot of quacks at that time, and there was a lot of disease at that time.
That historic meeting would have long-lasting effects. The Society's founders crafted the mission of their newly founded organization to promote the science and art of medicine, protection of public health, and the betterment of the medical profession. Through its 160 years of service, the California Medical Association has faced many challenges head first, including creating the state public health department in the 1870s, making smallpox immunization mandatory for school children in the 1880s, looking at ways to fund healthcare for the poor in the 1930s, performing some of the first cornea transplants, and setting up some of the first organ transplant guidelines in the country, and starting California's first medical schools, which became Stanford and the University of California. Today, the CMA is a hard-working team, still focused on the health of all Californians, preserving the way medicine is practiced, and keeping the physician-patient relationship intact.
We are fighting for a noble profession, and that's with an immense amount of pride for staff. There's not many entities that you can work for in Sacramento that you can go home and feel good about. The California Medical Association is absolutely one of those. There's not a single staffer here that doesn't believe in the physician-patient relationship and the honor of the profession of medicine.
In more modern times, the CMA has faced new kinds of challenges to the preservation of medicine, like the rising number of malpractice lawsuits that threatened practice in the 1970s. The CMA's answer was to work with Governor Jerry Brown to create MICRA, a 1975 landmark piece of legislation that protected patients and physicians, allowing for medicine to continue to be practiced as it had for decades. Since MICRA's passing in 1975, it's been challenged by trial lawyers and other groups, but throughout, the CMA has always been there to protect it, never more evident than in 2014, which saw the defeat of Proposition 46 and ensuring MICRA would continue to protect Californians. The CMA has also been supportive of future physicians, providing scholarships, free membership, and a voice in shaping medical policy in California.
With the Willow Clinic, the real thing that we're limited by here is resources, especially since it's all volunteer-based. And the way that the CMA has helped us out is that whenever we come up with an idea to increase our ability to provide patient care that is bound by resources, the CMA has been there to help us.
In 1963, the CMA led the nation as the first medical society to resolve to publicly promote the health risks associated with smoking. This resolution exploded in the press, with the story quickly spreading worldwide, setting the course for the campaign against tobacco. Through the years, the CMA has built this campaign that spoke out against secondhand smoking, consistently raised taxes on the cost of buying cigarettes, paved the way for smoke-free workplaces, and just this year will raise the smoking age in California from 18 to 21. The California Medical Association celebrates 160 years of ensuring the health for all Californians. It's remarkable to think of the foresight its founders had, as well as how their original vision has remained intact. The future looks bright in California thanks to the California Medical Association.
Congratulations to the CMA for 160 years, and keep going like you're always going.
I wish CMA is around for another 160 years to help everyone.
Here is to 160 years of more, of better, of justice, of equity, of inclusion, of diversity that reflects the rich tapestry of who we are as physicians and as servants to the state of California and to the communities that we love.
Congratulations, CMA. Muy bien hecho.
When I think about the CMA being 160 years old, it's nothing but pride that I came to California by chance because of the military, but I stayed in California because of the medical community. I love the CMA, I love being a member, I love the family that I've made of other physicians, and I'm very happy to be a part of the California Medical Association.